So today's series of discussion would be on the joint health. As we all know, bone gives shape, support and strength to the body. If the bone health deteriorates, we lose our confidence, even our gait, our walking style, everything, just the shape of the body also just changes. And bones, as we all know, protects the vital organs like brain, heart and lungs and all. And we can move freely only with the help of these bones, and we can even prevent the fracture and the disabilities also. Weak bones always reduces your quality of the life. So as I told you earlier, it makes to lose your confidence. Osteoporosis is called a silent disease because no one pays attention when your bones are osteoporotic in nature, because there are no warning symptoms of that, and people can lead a normal life and they often feel very normal. And the first sign is often a fracture, and that's how we know how effective and how important is it to care our joints, especially the osteo health with the knee joint pains and all. So diet, like as I told you earlier, diet is very important factor to prevent the osteoporotic changes. So here I have made some attempt in discussing about some culinary herbs and spices which you can easily get from your kitchen, and when you just start using it in a preventive stage. Let's protect our bones today so they protect us for a lifetime. So today's series of discussion would be on the joint health. Like the topic I have just made it is rewind the age of your joints through Ayurveda. So Ayurveda, as we all know, it's an ancient science and wonderful wisdom towards like many metabolic disorders, joint health, cardiac health, skin care, neuro, musculoskeletal, everything is so clearly in Ayurveda even 5000 years back. In Ayurveda is just something which is unchanged, and still people can follow it in a very simpler and easier way also. And even with my 2 decades of this clinical practice, I very frequently see many allopathy doctors, orthopedicians referring people to Ayurveda to prevent surgical interventions, and mostly as in preventive care, especially for the joint health. And we have like usually at least like 150 cases per day. In that I can quote 70 to 80 musculoskeletal disorders every day. We meet people, and that's how we know how effective and how important is it to care our joints, especially the osteo health with the knee joint pains and all. So I have made a small attempt in taking Ayurveda towards the public so that the joints can be healthy. Even there are some tips where you can try it at home to prevent the further deterioration. So myself, Dr. Tara Jayasri, I am working as medical superintendent in RM Research Institute located in Coimbatore. So today's content is Vedic wisdom of bone health, how Ayurveda sees the bone to be, and what is what is osteoarthritis and osteoporosis in a very simple way, and a role of herbs and nutrition and lifestyle which we can try in strengthening the bones and the joints, and some simple Ayurvedic therapies which can help to reduce the pain, stiffness and the deteriorations. So why does this bone health matters? Because many people think why bones and why we need to do preventive aspects to reduce the pain in the joints and all. As we all know, bone gives shape, support and strength to the body. If the bone health deteriorates, we lose our confidence, even our gait, our walking style, everything, just the shape of the body also just changes. And bones, as we all know, protects the vital organs like brain, heart and lungs and all. And we can move freely only with the help of these bones, and we can even prevent the fracture and the disabilities also. Weak bones always reduces your quality of the life. So as I told you earlier, it makes to lose your confidence. Like when you babble in front of others, we generally lose the confidence actually. So that is why the bone health really matters to every one of us. So what is called osteoporosis? So osteoporosis is, there are different grades in the degeneration of the bones. First one is osteopenia. That is where the bone starts, that is like we can say it's a grade 1. There are the chances are very minimal. The bone starts degrading. The second grade is called osteoporosis, where your density of the bones gradually just comes down. It is evolved from the term called osteo, that is the bone, and porosis, where they become porous. That is, we get lot of tiny pores inside the bone. That is the condition. And we all know bones are made up of the minerals like calcium, phosphorus, and all, which bound together by collagen fibrils. In this case of this osteoporosis, these fibrils and these minerals like calcium, phosphorus starts degrading. And osteoporosis is called a silent disease because no one pays attention when your bones are osteoporotic in nature, because there are no warning symptoms of that, and people can lead a normal life and they often feel very normal. And the first sign is often a fracture. So like for example, if you tend to fall down, you end up getting a fracture. So that is where you have a doubt towards whether your bones are osteoporotic or not. And common fracture sites are hip, spine, and wrist joints and all. So as it's a continuation from the previous slide, the bones are certain proteins stored up in the bones, where there is like the structural composition and the changes of the body tissues and the bones. They are called as bone morphogenetic proteins. So when there is a degradation of this, the osteoporosis enters inside your bones. And what is the causes? Like what are the premonitory nidana? We used to tell it in Sanskrit. What are the common causes of this osteoporosis? That is, first one is the sedentary lifestyle and lack of activity. So many people now, mainly in the IT professions and all, they don't have a very active lifestyle. So they at least sit 8 to 10 hours a day. So this could be one of the triggering factor for the osteoporotic changes in the bones. And low vitamin D. Especially I can say after this corona, our exposure towards the sun is very low. And now everyone takes this vitamin D supplement. Everyone takes zinc and these calcium supplement. We don't even know whether that is really needed and whether we can metabolize these kind of 16,000 kilocalories vitamin D like that. So, and low vitamin D is one of the main cause of this osteoporotic changes. And low calcium consumption. Like for example, many children are allergic to dairy products and all, where dairy products are the main sources of the calcium, and greens. Like many children deny taking all those varieties and all. So that could be one of the main reason for the low calcium consumption. And some hormonal imbalance like thyroid, diabetes, menopause. These are also one of the main reason for the osteoporotic changes. Like if you see to the hormonal influences, estrogen is one of the main hormone which maintains the balance between the bone resorption and bone formation. And due to the menopause, or like when you are aged between 40s and 45, your premenopausal symptoms just set into your body. So there you automatically lose almost 10 to 20% of when the estrogen starts secreting low in your body. The bone resorption happens, like almost 90% of bone resorption happens. And the bone formation and the calcium deposition is only 45% during that age. So which results in the rapid bone loss. Almost between that 45 to 40 to 47, we lose almost 20% of bone density naturally because of the low estrogen production in the body during your menopausal age. And one of the main other factor is genetic. So if you're inheriting your family with a very high risk of osteoporotic, definitely you will also get as a genetic disorder this osteoarthritic and osteoporotic changes. And women more than 35 years has especially they carry a higher risk if the family history is very positive for the osteoporotic changes. So not only a low calcium vitamin D deficiency leads to the osteoporotic changes, but also the hormonal influences like low estrogen, perimenopausal phase, genetics also plays a very important role in the osteoporotic changes in the body. So now this is a common picture where you can see the life cycle of the bone. So mainly the peak bone mass is between this 20 to 30 years. And as in child age, the calcium absorption is more and more. And we can see the osteoporotic changes between that 40 to 50, 60 years. And so this can be prevented only by the healthy food habits and also the lifestyle and therapies which can help in stopping or preventing the excessive bone loss with the age factor. So how does Ayurveda look into this osteoporosis? So what we can say is, according to Ayurveda, the bone mineral density is reducing because of the Vata disorder. Like we have three doshas, that is Vata, Pitta and Kapha. When there is excess Vata in the body, that is the air proportion in the body, we easily get these osteoporotic changes. So among the three doshas, when your Vata thing is more, we can expect the osteoporotic changes very easily. And one more main cause of factors what Ayurveda quotes is late night sleep. So this is where your Vata disorders just zoom in. So like especially IT professionals, students who study, who have a habit of sleeping in the late night and all, they can easily get osteoporotic changes. So this regular pattern, regular discipline of the life maintains the natural rhythm of the body. But this late night sleep aggravates Vata. It makes your system very dry. So there should be some amount of lubrication in your body to maintain the lubrication. It dries up your body along with your bones. And that is how the bone minerals and the deposits also gets eroded very easily. And one more main important factor is eating of packaged foods and processed food, soft drinks, those that maida biscuits and deep fried food, especially noodles, pasta, pizza, and the soda waters. And those who have a habit of regular consumption of these, what we say, low prana, we used to say, like these are the foods with no life in that. So when you very frequently consume these kind of food, your bones gets very easily dried. And other factors like stress and anxiety, I bet you there are no one individual without this stress and anxiety, too many thoughts. This again leads to the hormonal imbalance in the body, which again affects the bone health. And also, as I told you earlier, when there is too much erratic changes in the Vata, bones gets degraded very easily. And we can easily make out the difference because we can see frizzy hair, splitted hair ends, and the nail health, splitting nails. That also could be one of the indication of your bone health, because we see that also as one of the main diagnostic criteria. We see the nails of the patients also. If they have split ends, if they have too much cracks, we need to give something as a preventive aspects for the bones also. And also regular exposure to sunlight is very important. And we have many therapies like massages, abhyangam and all, with some oil which can be an antidote for this Vata. And once in a week is always recommended to improve the bone health also. So coming to the types of osteoporosis, localized osteoporosis, like for example, your shoulder joint is affected or your elbow joint is affected. That is where we have a localized pain. Generalized osteoporosis can affect the general like whole skeleton. In that also two types are there, primary and secondary. Primary is age related bone loss and postmenopausal estrogen loss also. Secondary could be, as I told you earlier, chronic illness, endocrine disorders like thyroid and all. And when you have a long-term medication, for example, you take diabetic medications, you take hypertension, you take medicines for thyroid, these can lead to secondary osteoporosis also. And some other nutritional deficiencies, as I told you earlier, low calcium and all, that could be one of the reason for that. Who is at risk? Like what category of people are at risk is always above 40, that is for sure. And postmenopausal lady and genetic, and those who have a very sedentary lifestyle, low calcium. And what are the risk factors for this is sedentary lifestyle, smoking and alcohol, elderly aged people, especially female. And other risk factors are like smoking, tobacco use, excess alcohol intake, sedentary lifestyle, and long term usage of steroid, thyroid, and digestive related disorders also. People, they are at risk. So common symptoms what you need to look for if your bones are degrading. You often frequently get back pain. You always feel weak, tired, and loss of height, especially the spinal osteoporosis. You get a kyphosis or you get a scoliosis backbone. So automatically your height is reducing and you get into a bent or a stooped posture, and whenever even if you fall very slightly, you get into a risk of fracture, and even you find it very difficult in doing your daily activities. For example, just to wash one or two vessels, you feel very tired and weak. And you can also watch for brittle nails, a weak hand grip, like if you want to lift something even half kilo, you can't grip your hand for that. And gum problem and tooth loss, the receding gums, very shaky tooth, and you feel very shorter than before. So these are some common symptoms what you need to look, because these are all not a very acute onset, it's a very gradual and a chronic onset. So these are the premonitory symptoms what you need to look for when your bones are at risk. So diet, like as I told you earlier, diet is very important factor to prevent the osteoporotic changes. So you can always choose food which are rich in calcium, vitamin D, vitamin K, vitamin C, magnesium. So these are the safeguarding and the shield for your bones, because as you all know, proper nutrients every day is very much needed for the bone health. Poor diet always weakens your bone, because the nutrition is the foundation of the prevention. You may not require any medications if you can just try to inculcate all these diet and lifestyle changes. You may not go into the stage where you need treatments. So these are some food which are rich in vitamin D, like low fat or non-fat milk, cheese, greens, turnip greens, kale, okra, Chinese cabbage, and dandelion greens, mustard green, broccoli, and some other vegetables like collard green, spinach. They are all very good in vitamin K, sprouts especially. These you can try to add it on your regular basis in your food pattern also. Vitamin C rich foods like red peppers, amla, oranges, grapefruits, papaya, pineapple, and magnesium rich foods like spinach, okra, potatoes, sweet potatoes, plantains, tomato products. These are all very good in safeguarding your bone health. So here I have made some attempt in discussing about some culinary herbs and spices which you can easily get from your kitchen, and when you just start using it in a preventive stage. So the first one is Boswellia. We call it as Kungilium in Telugu. Most of them are Telugu patients or listeners, I think. Last time I did a video equally correlating it with Telugu terms. So this is one of the important anti-inflammatory herb which we use it in maximum Ayurvedic medications. So this is called Boswellia. They are very good in 5-LOX. That is one of the main phytochemical in that, which are generally very good in reducing your pain and inflammations. So this is called Kungilium. There are a lot of purificatory procedures in that, and we use it mostly in the Ayurvedic medicine. And cayenne pepper, that is called the chili. So the capsicanoids, they act like as an anti-inflammatory, and they are to our wonder, they are used in many ointments, especially for the joint pains. This is one of the main ingredient. Because of this capsicanoid, they help as an anti-inflammatory, they reduce the pain immediately. And cinnamon, this is one of the very good supplementation which is very good in combating the inflammation. You can even use it in your daily tea consumption. Most of the North Indians add the cinnamon as a main ingredient in their tea, and in most of their dishes we can see cinnamon as a very commonly used ingredient from your kitchen. So if you just start using one piece, it can add the flavor. Also it helps like an anti-inflammatory for the people who have just started to feel the weaker bones. Next is the ginger. Again, as I told you about the cinnamon, ginger also plays a very vital role. It has an anti-inflammatory molecule called leukotrienes. Even ginger, the dry ginger powder, if we make it as a paste just with warm water and apply around the inflammatory joints, it immediately reduces the inflammation. So this is one of the very simple home remedy you can try if you don't have any skin burning or anything like that. So this you can even add it to your food patterns and also in your regular tea consumption. And the next is black pepper. The main ingredient in that is pipric acid, and we can add it along with our rasam, sambar, or whatever it may be, which helps as an anti-inflammatory agent. And garlic, that is the diallyl disulfide, is one of the very good anti-inflammatory compound which decreases the effect of pro-inflammatory cytokines. So we can start taking garlic milk, and even pepper, garlic, ginger, rasam can be used on a daily basis, which helps like an appetizer also. Because if you have paid attention, I have mentioned many digestive disorders can also lead to bone health. Many patients with irritable bowel syndrome, chronic constipation, they have a tendency to get these osteoporotic changes very easily. So these kind of appetizers like black pepper, ginger, garlic, they help as an Agni Vardaka, that is they improve your digestion and helps as an anti-inflammatory also. And ashwagandha, as we all know, that is a very common medicine which helps as an rejuvenatory effect, especially the joint pain. You can take it in the form of pills, and you can even add it in the form of powder. We have lehiums if you are not diabetic. So daily consumption of at least 1 spoon with milk can help in improving your osteo health. Eucalyptus, like many people, you might have seen applying eucalyptus oil. So this active component, the tannins, immediately reduces the swelling, and also it helps like an anti-inflammatory, especially for the joint pains, neck pain and all. You can use this eucalyptus oil. Next is dhania seed, that is the celery seed, that we used to say, and dry coriander powder. You can at least make it as a tea form, or you can even take like the celery seed infused water. Just when you boil your water, you can add 1 or 2 teaspoons of the celery seed, which helps like an appetizer. And also it is a very good proven medicine to reduce your joint inflammation also. Then aloe vera. So the main estimation of this, like the mineral estimation of this leaf pulp, especially with magnesium, calcium, zinc, selenium, and copper. There are many people who take this gel of this on an empty stomach. And even in Ayurveda, we have one therapy where we tie this gel alone among to the place where there is an acute inflammation. So that helps to immediately, if you can see if that inflammatory joint is very warm. For example, you can see a reddish swelling and a reddish discoloration and warmthness when you touch your knee and all. That is a sign of an acute inflammation. When you just take the pulp of this aloe vera and tie around your joint as an lepam or an poultice, there is an immediate relief in your joint pain. Even internally you can take it if you don't have an allergic towards the cold, sneezing and all, because it's a very cooling medicine. Those who have a tendency for the sinusitis and all, they are this is contraindicatory. But if your body's heat is too much, you can always try taking aloe vera internally and also for an external application. Next is thyme, that is omam or ajwain. This one is again one of the very common kitchen herb, which is mainly used for food flavoring. And we usually give it for children who have a very heavy worm infestation. But this is like, as you all know, this has an antimicrobial property. This can equally help in reducing the rheumatoid arthritis, provided it is detected in the early stages, because this fragrant herb is highly rich in antioxidant capacity. And turmeric, this is, as we all know, and very heavy anti-inflammatory agent. You can even add it with your food, which can increase the flavor. And we are very commonly, we take golden milk after this corona, where the compound found in the black pepper can reduce the inflammation, and it can improve the curcumin in the turmeric. That is, when we add the milk with a little pepper and like turmeric in that, it activates the piperine in the black pepper and also doubles the action of this curcumin. That is the compound found in the manjal, that is the turmeric. So golden milk is always on a regular basis works as an anti-inflammatory. not only for the joint but also for many respiratory illness also. Next is noni fruit. So this is again a seasonal. It has lot of anti-inflammatory property, and it really helps to improve the flexibility and the mobility of the joints. Next is like nirgundi, we used to say. We in Tamil we call it as nochi, and in Telugu we call it as vavili. So this is again a very common herb where we use the decoctions and the bark of this tree in many of the Ayurvedic decoctions. And we also have a treatment called potli, which I am explaining a little later. We have a bundle of medicated leaves. In that, one of the ingredient is nochi, which has highly anti-inflammatory and antioxidant. Even when this is a very common herb, you can add it with your water which you use to take bath also. Like when you boil your water with this nochi leaves, this helps to reduce the joint pains also. Next is rasna. This is again in Telugu we call it as vavu pushpam, and this is called chittarathai in Tamil. And again the phytonutrients in that helps as an anti-inflammatory and antioxidant. We have these, the rhizomes are the main ingredient of that. We have it in powder form, we have it in decoction forms also, which helps as an anti-inflammatory. Next is flaxseed oil. So an internal consumption of this flaxseed, also external application of this flaxseed oil helps to ease the joint inflammation, because they are very rich in a compound, and it's a very important omega-3 and fatty acid compound, which plays a very vital role in reducing the joint inflammation. Next is rose hips. So this is something which we often dispose, especially when we have mala or when we offer mala to God, and when they just dry, they just dispose. But this is one of the very important ingredient which reduces the inflammation, because they are very rich in COX-1 and COX-2 phytonutrient, and there are many oils, like you might have heard about rose hip oil. It plays a very vital role in reducing the joint inflammation. Next is guduchi. This is called Amritavalli, a very popular herb after corona, and you might have seen about like guduchi sattvam. They come as a capsule, they come as a powder, they come as a herbal decoction. They are commonly used as an anti-osteoporotic agent, and this is also one of the herb where we use it in many herbal decoctions, which helps as an anti-inflammatory. This is again a very common herb. It is like a tendril climber. Next is shatavari. We know it as many like a herb which is very commonly used as in gynec related disorder, but this is again a very good supplement for bone health after menopause. This comes in the form of tablets, it comes in the form of powder, it comes in the form of lehium. If you are not diabetic, you can easily take 1 spoon of shatavari lehium to improve the bone loss after menopause. Then this is like a lotus seed, tamarai vidaigal, we used to tell it in Tamil. We can just dry roast it and use it as a normal snack on a daily basis. You can just roast it with little bit masala, pepper, turmeric, whatever you like, and because they are very good in calcium and phosphorus also. And this is again one of the common plant which you might have seen. This is called hadjod. Even the name indicates that it can join the bones. In Tamil, it is called pirandai, a very common herb. We can use it in the form of chutney. We have oils in that, we have powders in that, because this is a very good natural calcium. For a fracture joints, you need it if it, for a hairline fracture or a fracture in a minor joint. Chutney made with this for a regular consumption for 45 to 50 days can prove wonders in any kind of fractures also. Then comes drumstick leaves. You can have it in the form of daily soup or in sambar, whatever. They also help in relieving the joint pains, because this is a very good analgesic also. Next comes black sesame seed, especially post-menopausal bone density. To improve that, you can have a small sesame seed balls, but not with sugar, with jaggery, because they are very good in rich in copper, magnesium, calcium, omega-3 fats also. Then comes ragi, that is finger millets. You can make it in the form of soup, you can make it in the form of milk with little jaggery, or you can even mix it with buttermilk. This helps in improving the calcium. They are, because they have a very high content of calcium. So these are some common dietary supplements what you can use it to prevent the osteoporotic changes. But my request is use it on a daily basis. Once if your bone joints are completely worn out, you can't just, this will help us in supplementation for your joint so that it doesn't prevent the further deterioration. Because once when you come into this category of this osteoporotic joint changes, this is a process, that is a progressive and degenerative disorder. By using these kind of culinary spices, and you can only prevent it further getting deteriorate, but not stop the agents. But it is better to get an proper advice from the doctor, your doctor also. But the one which I have already discussed is a very common spices and the herb which any kind of patients can use, but especially with when you take the ashwagandha and all, you need a proper advice of a doctor. So now we'll jump on to some treatment possibilities which can help you to reduce osteoarthritic changes in the knee. First one is lepam, like that is the warm anointments. That is like we apply some paste around your joints. This photo indicates the knee joint pains. We have different powders like Jatamayadi, Grihadumadi, Kottam Chukkadi Churnam, Nagaradi. Nagaradi Churnam is where I mentioned you about the ginger. That is the main ingredient of that. So when we mix it with that particular liquid, we use either hot water, we use rice washed water, we use oil to make it like a paste, and we just make it as a band around your joint which is inflamed. So this is one kind of treatment called lepam, where you can use it at your home. Even that nochi leaf, what I discussed you earlier slides, that can be made as a warm ornament also. Even the castor oil seed, castor oil leaf can be tied around your knee joint. Slightly warm it up and make it as a like a lepam around that. That can help to prevent the inflammations immediately. Next is called Januvasti. This is like nothing but a local pooling of oil. So this picture indicates the patient is having the knee joint pain, knee joint osteoarthritic. So this is like we make a wall around your knee with like a ready-made pool-like thing, and we stagnate some medicated oil inside that. And we seal the sides of this particular plastic container, and this process takes 30 to 40 minutes. When the warmthness of the oil comes down, we remove it and use it for the next day. So how does this act? Like this boosts the circulation and tones up the muscles. It moisturizes the skin. It improves the lymphatic flow and reduces the inflammation. So this is some localized treatment what we usually use it in our hospital. This process is called Januvasti. But what oil to be used inside should be referred by the proper Ayurvedic doctor. Next is the poultice. I think you remember me telling about that nochi talai and all. We make a different potli. One potli is with the leaves, one potli is with the powder, one potli is with the rice and all. We give hot fermentation to that particular joint. We make it like a potli, and we make it like we warm it in a pan, and then we give some hot fermentations. So how does this act? It helps to improve the joint movement and reduces the stiffness of the joints also. You can use that nirgundi leaf, you can use tamarind leaves, you can use like castor leaves and all. You make it as a small potli and just warm it up and give a very lukewarm fermentation to your joints, which can help to reduce the pains. Next is called Nadi Sweda. This is like local fermentation. We boil certain decoctions in a cooker or in a boiler, and we make the fumes to get exposed to your particular joints. So this heat dilates the blood vessels and it improves the circulation, reduces the muscle spasm, and it helps to improve the circulation. So this is one more therapy what we commonly use in our hospital. This is called Nadi Svedam, which is nothing but localized fermentation. Next is called Valuka Svedam. This is nothing but sand Svedam. We make a plain sand in form of potli, and we just because sand, as you know, it is a very good heat conductor. Because of the heat nature, it improves the circulation and it helps to relieve the pain also. Next comes local pilichil. This is nothing but pouring of medicated oil to that particular joint. So especially knee joint or shoulder joint or could be a wrist joint. We warm the oil repeatedly and we pour it to that for at least 30 to 40 minutes, which helps to reduce the pain and the swelling. This treatment is called local pilichil. Next is called vasti, that is enema, colon cleansing. This is one of the main treatment panchakarma what we do for any kind of osteo. They say the vada, that is the air proportion of your body, resides in your colon. So once when your colon is properly cleansed, all the vada, that is the any disease which is coming with aggravated vada, will get under control. So by repeated enemas with medicated oil, medicated kashayam, can keep your bones in a very healthy state. Then comes Agni Karma. Agni Karma is a treatment called local cauterization. We have an hammer like thing made with the copper and we just cauterize that particular joint, because this can even help in neurologic pain also. Many people come with intolerable pain in the knee. When we touch that joint and all, they don't even allow you to touch that particular joint. So this kind of local insensitizing that area will help to reduce the pain. But this is again has to be done by a proper practitioner only. So next comes Sira Vedam, that is bloodletting therapy. We have different ways of that. So we just tight tourniquet just 2-3 inches above that particular joint and we cut the vein, and this is called Vidya Karma, that is letting the impure blood from that particular place. So our theory is we just take the aggravated vada out and that is how we improve the blood circulation. So again this has to be done under a proper doctor's supervision only. Next comes the use of Jaluka, that is leech. We have some medicated leech, non-poisonous leech, where we collect it during that particular season, good water pond leech. So this is again one of the main therapy which is very effective to reduce the inflammation immediately. According to our concept, this is like the leech saliva has a particular enzyme called hydrodine. So this improves the circulation, it improves the micro circulation by reducing the blood viscosity. So this is one of the panchakarma what we do it in our hospital. We let the leech to bite that particular inflamed joint and it becomes bigger by sucking all the impure blood from that particular joint. And once it is done, we make the leech to re-vomit all the blood which it has just sucked, and we clean it for that particular, we don't use it for the next 3 to 6 months timing. So this is a very effective treatment commonly practiced in Ayurveda, and it's a very acute inflammatory joint. It helps to reduce the joint pains immediately. So many people will have doubts like when to expose, because now I have been telling you have to get exposed. You need vitamin D from your sunlight, and sunlight is the richest source. Whatever oral consumption you take with either in the form of tablets or whatever it may be, food ingredients or whatever it may be, sunlight is the richest source, and the maximum amount of energy what you get from sunlight cannot be compensated with any of your supplementation, provided your digestion is very good. So many people will have the doubt which is the best time for this vitamin D. The best time is between 10 a.m. and 2 p.m. So this is the time where you can get exposed at least 10 to 15 minutes in your balcony or terrace or in your garden, where your absorption of the sunlight, the vitamin D from your sunlight is very richest. So why do we select this time? Because only during this period the sunlight contains UVB rays, and this helps the skin to produce your vitamin D naturally. And early morning sunlight, that is before 9 a.m. is also good, but they are not as rich as vitamin like the one between 10 a.m. and 2 p.m. And recommended exposure is only between 15 to 30 minutes, and expose your face, arms and the leg, and don't use any sunscreen or anything during this exposure. And precaution you need to take is don't stay for too long, because again with the threat of the sunburn, and those who have a very sensitive skin, just prefer between 10 to 11 a.m. because this can lead to sunburns also. So as we all know, modern treatment options are like only preventing the further bone loss and reducing the fracture risk and improve the quality of the life, and they are just going to give you some calcium and vitamin D supplement and some hormonal therapies if required and some bone strengthening medicines. But in Ayurveda we have n number of theories starting from your kitchen, which towards your treatment exposure also. We have wonderful therapies and wonderful medications which can prevent the further deteriorations also. And I would like to include some simple yogasanas also, like Tadasana, that is mountain pose, Rikshasana, that is the tree pose, Vajrasana, thunderbolt pose, Setu Bandhasana, bridge pose, Pavana Muktasana, wind relieving pose. Some general guidelines what I would like to include is practice very slowly and gently. Don't do, nothing is going to change overnight. Gradually start with, and avoid any jerky movements because again with the fracture risk. And do yoga daily, preferably when you get exposed to your sunlight and all. And just stop it immediately if the pain aggravates. Then you need a proper doctor's advice when you do certain intense asanas and all. But these are some common asanas what you can do it when you are exposing to your sunlight. So can osteoporosis be prevented? Yes, in many cases, provided you intervene with the proper doctor's advice and the guidance. And early awareness is always the key for osteoporosis. And healthy lifestyle with proper diet and regular exercise and regular checkups with high risk people. By making all these in one line, you can definitely prevent the osteoporosis. Once if it sets in, you can't stop it because as I told you earlier, it is a progressive and degenerative disorders and no one pays attention in the early symptoms. And I have already discussed the symptoms what you need to look for in the early stages. But you can definitely prevent the further deterioration and your intensity of the sufferings also. So thank you for your patience listening. Let's protect our bones today so they protect us for a lifetime. And I am always committed to your bone health and forever grateful for the opportunity.